Hey y'all, good evening, good evening, good evening. Come on in and say hi to me tonight. Thank you very much for joining me for another episode of Relax Well with Dr. Dietrich. So come on in, whoever's coming on in, just say hi, maybe where you're listening from. I'd love to hear that. Tag folks to come on in, share this live stream, of course. If you're watching it on the replay, please put hashtag replay in the comments. Thank you. So tonight, I'm going to be talking about secondhand anxiety. What? What is that? What is secondhand anxiety? Yes, secondhand anxiety. So I know you've heard of the term like secondhand smoke. I won't go into that, but we know what the effects of secondhand smoke can be. It can be very detrimental. So kind of think about it that way. Hey, Stephanie, thank you very much for joining. Tag folks to come on in. I'm talking about secondhand anxiety tonight, or secondhand stress, stress spreading, that kind of thing. So, secondhand anxiety really isn't like a psychological diagnosis. Diagnosis is more like neurological. And actually, by the way, I got this information from many different sources. Talkspace, all the way up to the National Institutes of Health. And if you're really, really dying to know what my sources are for tonight's presentation, just go ahead and direct message me, and I'll be happy to send you my sources and the different links. Okay. And let's see. Before I go any further, let me see. Let me make sure I don't want to snub anybody. Before I go any further, I actually want to talk about the concept or the term mirror neurons. Mirror neurons. It's like, what are you talking about? Am I getting ready to get extra technical? No, I'm not fixing to get extra technical. I just want to give you a little bit of a background. Hey, Trina, thanks for joining. Hey, Susie, thank you for joining. I'm talking about secondhand anxiety, y'all. So I'm introducing the concept or the term of mirror neurons. But I'll back up. Neurons are basically nerve cells. I've talked about this on other live streams, but neurons are nerve cells. And mirror neurons are actually a class of neurons that can kind of alter their activity both when a person is executing a specific action or or a different emotion or feeling from another person. So it's like a mirror, basically a mirror. And basically, these are a group of specialized neurons that mirror the actions and behaviors of others. Boom. Okay. Hey, Sally, thank you for joining in. Mirror neurons are basically a group of specialized neurons that mirror the actions and behaviors of others. And they actually help us when we're watching something to learn a task or just to do something. We see what someone else is doing and we actually try and emulate that or mirror that so we can get it done as well. But the same thing goes along with emotions and stress and anxiety. um, Sometimes we can actually feel what someone else is feeling when they are emitting stress and anxiety. So this what tonight's topic is secondhand anxiety. And I know you've experienced it before. You're minding your own business, life is good, you're relaxed, and your friend or someone comes and tell you something that is just very dreadful that's happening to them or very devastating. And it's not happening to you, but it's happening to them. But they're so stressed out about it and anxious about it and tearful about it. And then the next thing you know, you're like stressed and anxious and tearful as well, so you're having that empathy going on along, but you're actually feeling those same emotions as the stress and anxiety, but it's not actually happening to you. So those are those mirror neurons kicking in. And I just wanted to back up just a little bit to make sure I differentiate the term between sympathy and empathy. Sometimes we use that kind of interchangeably, but they're not exactly the same. Hey, Nisa, thanks for joining. Sympathy is actually a feeling of care and concern for someone. Often the time it's someone that you're close to and you want them to be better off or happier. If you're expressing empathy, it's actually the person's their ability to recognize and kind of share those emotions of another person. So it's a little bit different. You actually see what's going on. You see it from their perspective, and then you're sharing in those emotions, or their distress or happiness. All that. So that's kind of a subtle difference of the difference between sympathy and empathy. Now the question is, you're experiencing this secondhand anxiety. How can you help yourself with it, or how can you stop it, or how can you treat it? We already stressed about a lot of other things. So, let alone being anxious because someone else is anxious and they're projecting that onto you or you're accepting that. One of the ways is what I talk about in all of my live streams when dealing with stress and anxiety, acute stress and anxiety, is take a brief moment and just do some deep breathing. I know I mentioned it a lot, but it's really, really the cornerstone of stress management and anxiety, especially in my humble opinion. When you're doing this deep breathing, you're actually turning on your parasympathetic nervous system, which is that nervous system, again, that signals to your body, I'm safe, I can rest, I can digest, life is okay, I'm calm. And that's what deep breathing does. It's not just a matter of taking a couple deep breaths, but it's true belly breathing, just positive visualization, just taking those deep breaths that can hopefully help activate that parasympathetic nervous system. Another way to help with the secondhand anxiety is to actually listen to someone with that empathetic ear. Let them have their feelings and their emotions. It's theirs, So be there for them, be that listening ear, because a lot of the times people may just want someone to talk to, not necessarily give their opinion, but just be the empathetic ear for them, but acknowledge that it's their emotion. Another way is to actually use those those mirror neurons to your benefit. Okay, just like they can work against you. Someone's stressed out, you start feeling stressed out, stressed and anxious. Why don't you try and turn that into good or positivity? Try and look at something happy, something that gives you a smile. Mirror that. Something that gives you a laugh. Look at that and mirror that, because you truth be told, you see somebody having a good laugh and whatnot, you like, oh, what are they laughing about? And you start smiling and laughing as well. Now, y'all probably thinking like, no, if my best friend up here, crying on my shoulder and stressed out and all that stuff, I'm not gonna just start laughing. I don't mean it that way. What I'm saying is, when you can find the time, you need to go and reset yourself and use those mirror neurons to benefit you in a positive way when, of course, you are able to. So, of course, use your emotions and your empathetic ear in the appropriate setting and, appropriately. But when you get a chance to use those mirror neurons for positive things, definitely take advantage of that and kind of reset yourself, which actually goes along with the last tip that I have for you, is to actually make some space. And what I mean by that is, if you find yourself like getting ready to have a meltdown because someone else you are around is getting ready to have a meltdown, or they're having a meltdown, you really just need to kind of excuse yourself from that area and that situation and just reset. Do your deep breathing, do whatever you need to do. It doesn't mean turn a blind eye to their suffering and their pain and their anxiety. It just means you need to get it together. Two people mirroring each other having a meltdown is probably not a pretty sight. Okay. And so that's just a suggestion with that. And actually, in closing, secondhand anxiety may actually be a new concept for y'all, but it's not new. You know what I mean? And we've all been there. I know I have. Personally, when I'm talking to patients and I hear the distress that they're really having, I really start to feel stressed out myself. I'm just being honest. Or even when I'm watching like the news, or especially like if I hear the ambulance going, I feel stressed because I know that the person in the ambulance is suffering. I mean, you don't have an ambulance ride when a happy occasion is going on. So I mean, I know I need to get a grip on that, but when I hear that ambulance just going, I really feel like upset about it. And I really don't like that, but I mean that's my empathetic nature, that I know someone is suffering, whoever is in an ambulance. And another thing is I really just hate seeing people cry. It just really makes me feel bad. So those are those for me those mirror neurons that are really kicking in and overdrive. And so, learning how to calm myself down better is what I need to do so it doesn't promote my own chronic anxiety. And actually, y'all, that's why it's so important to get a hand on secondhand anxiety, hell, even firsthand anxiety when you're experiencing it yourself. Um, it's important to actually, protect yourself from this because chronic stress, chronic anxiety definitely leads to long term health problems. Boom, we know that. The diabetes, the hypertension, the anxiety, depression, muscle aches, headaches, all that kind of stuff that I've talked about, over the past few months and years. So just please, please, please take care of yourself, um, and be aware of your own anxiety triggers and decrease your exposure to secondhand anxiety. Um, so, chronic anxiety and stress from wherever the source just basically hurts you and your health. So that's all I have tonight. I would love to see any comments that are going on or any thoughts that y'all have. I'll just wait to let me know if secondhand anxiety is a new concept for y'all or if it's something that you were already quite aware of for the term. Maybe not I mean, the actions of it, but like the term, secondhand anxiety. Any thoughts about that? And I know sometimes there's a little bit of a delay, but like I said, going back, sometimes, being a doctor, we definitely need to get our emotions in check. Of course, we care, but it can be definitely a challenge, not just taking on every single uh, problem or stressor that the patients that we treat are on because it can definitely harm us. You know what I mean? So it could definitely be a stressful profession, a stressful career, especially if we don't know how to de-stress, rather. And I guess I don't think I see any other comments. Um, so I just really appreciate y'all's attention tonight. And I will be back here next week for another episode of Relax Well with Dr. Dietrich every Wednesday night at 8 p.m. Central Standard Time. All right, y'all have a good evening. Bye.